That's right, Greg. So I heard from doctors and administrators. They say, look, this was already a busy summer. As you'll hear, COVID has really brought a lot of hospitals right up to the edge. We heard it from Dr. George Diaz from Providence and Everett.
And our staff is frankly frustrated and about what's going on now. They can look out the window and see that the people protesting against vaccines outside can't see what's happening inside the building, which is very sick people on oxygen in the ICU.
Just this week, our cameras took you into the ICU at Harborview in Seattle. The patients here aren't 65 and up like in past waves. They're in their 30s, 40s, and 50s.
Well, this is our medical intensive care unit.
Dr. James Town is medical director for the ICU.
More cases with more hospitalizations going on at the same time only makes us more concerned for what's down the road, and that we'll have more cases coming in when the hospitals are already pretty full.
COVID hospitalizations are at the highest they have ever been in Washington state, which is terrible news to report.
Cassie Sauer heads the Washington State Hospital Association, and this chart showing the upswing is already a few days out of date.
The highest we ever were was in December with about 1,100 patients, and right now we are at 1,240 hospitalized patients across Washington state as of this morning.
We also heard about staffing shortages. Shane McGuire heads Columbia County Health System in rural eastern Washington.
And we're having to compete and bid for staff. We frequently will throw out a number and they'll say that's not good enough. That's not going to get you a nurse. You're going to have to go higher per hour, which is, a financial strain on us.
But while COVID is hitting record numbers, it's not just COVID patients filling beds. Far from it. There are those patients in the hospital now because they avoided hospital and doctor visits during the first COVID waves. One doctor citing conditions like serious high blood pressure that, when neglected, can end up in a crisis. Then there's the summer trauma season, from gunshots to ladder falls to entanglements with hedge trimmers.
Be careful with yourself, be careful with your family so you don't need trauma care.
Now, Cassie Sauer did make this point. She says if you need to go to the hospital, go. Don't avoid it. They can accommodate you. But basically today was a warning to the unvaccinated to get your shots. Live in Seattle, Glenn Farley, King 5 News.